All right, everybody. Good afternoon. Why don't we get started? My name is Sanindya Bala, and I am the Chief of 2Gen Strategies here at Roca. And I'm very pleased to have you all join us today and thrilled especially that it's International Women's Day. And we're talking about a population that's very near and dear to my heart. A group of very incredible young mothers and their children, and actually young parents and their children. But today we're going to focus a little bit on young mothers. And so to start us off, I would like to turn it over to Roca's board member, Angie Jansen, who is also the chair of Roca's Young Mothers Advisory Board, for some opening remarks.
Thank you, Sanindya, and hi everyone, welcome. It is my great pleasure as chair of Roca's Young Mothers Advisory Board to welcome everyone to this important discussion, a year in the spotlight, an update of Roca's young mothers and the impact of the COVID-19 pandemic. And as Sanindya just did, I'd also like to acknowledge that our discussion today takes place on International Women's Day. While the challenges of Roca's young mothers are intensely local, with their outcomes contingent on the specific social and economic pressures of our region, their story takes place within the greater context of a growing recognition that securing positive outcomes for women is crucial for the health and stamina of our societies at large. Studies have shown that when women are gainfully employed, they reinvest up to 90% of their incomes back into their children and their families, compared to just 30 to 40% by men. Mothers have also been shown to invest their educational gains into making more careful nutritional, healthcare, and educational decisions for their children and families. So investing in women creates long-term social and economic benefits for all individuals, the communities they inhabit, and the world as a whole. The global theme of International Women's Day this year is Choose to Challenge. And Roca's model has always been to challenge the assumption that there are women who, because of the depth of their trauma or their risk level or their lack of willingness to participate in social interventions, are beyond the scope of help or are less deserving of the resources it would take to support them. Many of you have heard us talk about this group of young women before. They are mothers between the ages of 16 and 24 years old, yet they're not in school and not employed. They're gang involved or involved in the justice system, and they do not attend parenting programs and have been unresponsive historically to home visiting programs. The fact of their being a young mother is itself often the most visible result of a long history of trauma. At the same time, we know that they are resilient, courageous, and that nothing is more important to them than their children. We know that while it is incredibly difficult to build relationships within this group, once those relationships are fostered, they tend to stick and drive great rates of success. Currently, Roca works with over 250 young mothers and their more than 330 children. 75% of these mothers complete their first 2 years of employment placed in outside jobs, and 88% of their children show improved developmental outcomes. As was indicated in the invitation to this event, the challenges of 2020, as caused by the coronavirus pandemic, have thrown their plight into sharp relief. Over the past year, we've better understood what sets them apart, why they are unseen and often underserved, and we have identified new fault lines in the systems designed to prevent them from failing. The pandemic has challenged not just the progress of our young mothers in stabilizing their domestic and economic situations, but also the progress we have made in getting them to trust that the system can work on their behalf. At the same time, we have an unprecedented opportunity, not just to support our specific group of 250 plus young women, but to extract learnings that can be applied to communities nationwide. As Roca builds out the Roca Impact Institute, we are expanding our reach beyond the communities where we provide direct service by educating other direct service providers on the strategies that are both most portable and most effective. So the ripple effects of conversations like these stand to be magnified in the years to come. That is why we hope that over the next hour, we'll be able to illuminate some of the most critical learnings of the past year. How can systems designed to support public health and economic stability intersect to ensure that this most vulnerable group isn't left behind in future times of crisis? How can we use what we have learned about patterns of domestic violence and child endangerment to predict and prevent future spikes in both when challenges like those presented by COVID-19 arise in the future. As you listen, we hope that you keep note of your inspirations and ideas that might contribute to the solutions we have at hand. And by the end of the session, we hope we can engage you all in a call to action to help these young mothers and children survive and thrive. I will hand it back over to Sunindya, who will be moderating this discussion. She'll start by giving us a brief overview of these young mothers and then engage a panel of 3 phenomenal women leaders from within the systems that work closest with these young mothers.
Thank you so much, Angie. You set that up so beautifully for us today. Many of you who are joining us today are not new to Roca and are not new to hearing us talk about this population of mothers. And so today, what we'd like to do is to really put this group of mothers in context and really explain to you who they are, why they're so significant, what we've learned about them over the past year, and what the implications are for them, more so than any other vulnerable populations as we navigate the impact of the COVID-19 pandemic. We had a treat for you today in that we were going to have one of our young mothers actually share her story. But as often happens, she's been a little bit hesitant. But she has been working on sharing her story because she has an incredible story to tell. And so what we do have is a treat for you afterwards where we're going to be sending out a video recording of her story, which she and I worked on yesterday. But let me start by just giving us some brief overview information and setting the context. And then I really want you to hear from the people and the systems that are engaging with these women and are providing some incredibly innovative solutions to the complex problems that they face every day. So this is Brianna. And after this presentation, when we email you a thank you, we will also email you Brianna's story. She is very excited to share it with you and hopes to be able to do so one day in person. Brianna is one of those many women that we work with that Angie mentioned. And over the past year, what we have learned is that this is a group of young women who have often been unseen and underserved and fall through the cracks of programs that are designed to serve them. Wonderful programs that provide wonderful wraparound services, but this is a whole different group that we're talking about. When we say high-risk young mothers, we're working with mothers who have been who have significant trauma and are repeating intergenerational cycles of poverty themselves, which put them at the center of multiple risk factors that in turn perpetuate trauma and instability. Last year, we had the opportunity to work with a team at Deloitte to do some information gathering on who this population is, to help us define their trauma, and to help us really understand what happens if we don't help them. Repeated early exposure to trauma really lies at the center of the demographic, socioeconomic, and behavioral risk factors that these women face. As we know from the events of the past year, racial and gender discrimination also play a huge role to this. When we're talking about this group of very isolated and underserved young mothers, they are not the traditional young parents. We have many young parents in society who are currently struggling. They're struggling to survive and to thrive. They're losing jobs as a result of the COVID-19 pandemic. They are struggling to make 2 ends meet. But we are talking about a population that isn't even at the starting line. I'll briefly refer to the numbers we know in terms of Roca's young mothers, just as a comparison. So when we talk about Roca's young mothers, they are the most vulnerable of a high-risk population who are trapped within intergenerational cycles of trauma and poverty. They and their children are vastly more susceptible to many risk factors, including involvement with multiple systems, including child welfare and criminal justice. They are significantly less likely to complete high school. They are significantly more likely to live in poverty. And they themselves are repeating intergenerational cycles. They also have high levels of trauma as measured by adverse childhood experiences. So when we think about their trauma, it really underpins the complex systems challenges that they face and their interactions with all of the systems, both those that they should be engaging with and those that they really should not. And so what we've learned is that trauma and its related experiences really alter these young mothers' path to self-sufficiency. And the cost of this is significant. We know that due to the trauma that disconnects young mothers from systems and programs designed to stabilize them, they're actually experiencing lost annual benefits of approximately $61,000 annually. We also know that trauma increases young mothers' engagement with systems and programs that may create negative consequences, such as criminal justice and child welfare. And through this, we know that they incur approximately $106,000 in annual costs. And when we think about what it costs for us to intervene, it costs approximately $35,000 per family for one young mother and her children to go through Roca's intervention model over the course of 3 to 4 years. We also, with the work of Deloitte, have been able to estimate approximately how many of these women exist. And what we know is that when we put filters to this population and apply the communities in which they live in, along with the traumas that they experience, we know that there are approximately 5,500 high-risk young moms across Massachusetts. And when we think about the total population cost to us as a society, this is $1 billion in their lifetime per mom and child through lost benefits from systems they are not engaged in, like education and welfare, plus the systems they are engaged in that may have negative consequences. They are in communities with high rates of teen pregnancy, several times higher than the state average, high high school dropout, high COVID rates, high poverty, and many of them, the majority of them, are Black and Latina. They have high exposure to urban violence, and they need a long and intensive and long-term approach that allows for setbacks and for moving them through the stages of change and understanding their adolescent brain development and trauma. So what they really need in order to overcome the impacts of this severe childhood trauma is a high-touch and trauma-informed approach that existing programs do not provide because they do not know how. And so before I turn it over to our panelists, I do want to talk about the impact of COVID and what we've seen at Roca. This has really been a physical and mental health crisis. Roca's young mothers and their children are experiencing an unprecedented increase in poverty and violence, which will really have lasting impacts on their physical, emotional, and economic stability for the next 2 to 3 years. Out of 120 young mothers that Roca worked with throughout the peak months of the pandemic from April through October of 2020, about 50% of them lost their jobs and were ineligible for financial assistance such as unemployment. 55 experienced housing instability, 45 were victims of domestic violence, 24 tested positive for COVID, and 26 have had symptoms or were exposed but afraid to get tested due to fear of losing their children. 19 had open cases of child abuse and neglect, largely due to mental health, increased substance use, and or domestic violence concerns. And at one point, Roca was actually getting 1 to 2 referrals a week by DCF because of the significant need for young mothers and their children to be receiving supports and services. So with that, I actually would like to pause and turn it over to our panelists. And so I am going to first introduce, we have a phenomenal panel of women that I'm very privileged to work with. We have Kamaria Moore-Hollis, who is the Economic Mobility Manager for the Massachusetts Department of Transitional Assistance. We have Monica Fernandez-Castro, Area Director of the Harbor Area Office of the Massachusetts Department of Children and Families. And we have Lisette Gil-Sanchez, the Massachusetts Pregnant and Parenting Teen Initiative Program Coordinator out of the Office of Sexual Health and Youth Development at the Massachusetts Department of Public Health. And so I would first, I would love to briefly have each of you introduce yourselves and talk about what are some of the biggest challenges that you and your staff are seeing among young parents needing assistance right now that you work with in your programs. And so why don't we start with Kamaria?
Thanks, India, and good afternoon, everyone. Thank you for having me today. So biggest challenges, I mean, I would just echo everything that India just presented, except, you know, we're seeing these challenges for all of our families, not just young parents, but they are exacerbated much more just by the mere fact that they're young parents, and then exacerbated even more by the specific young moms that Roca is working with. So kind of at the beginning, we saw that there was just a real crisis of meeting the basic needs, just making sure that folks were getting food and getting, getting technology, because right now that is a basic need for folks. So, you know, we kind of tried to do everything that we could to make sure that we were supporting our providers and our network of communities in making sure that our young parents specifically were getting access to everything that they needed to do. So, you know, as we've moved through this and realized that this will continue to be our new way of life, we're just continuing to explore different ways that we can continue to support our providers and just kind of getting out of the way, because, you know, we support a young parent program statewide, and young parents have different needs in different regions, and certain programs work with a different set of young parents like Roca than maybe another program. And so, you know, the best thing we can do as a department is just get out of the way and allow our providers to do the work that needs to be done. So I hope that answered your questions, India. You muted.
Monica, how about you? What has your experience been with this population during COVID?
Good afternoon. I'm Monica Fernandez Castro, and I am very happy to be here. I am the area director for the DCF office in Chelsea. It's the harbor office for DCF. So I would say something similar, that all of the issues and challenges that you presented in India, we have seen that in our population, specific for young mothers. My office has 2 adolescent units, and we have many of those young mothers in those units. They specialize in working with kind of our older adolescents, but we also have young mothers in other units. Some of the challenges that we have seen during this last year are like pretty standard to women in general for our population. The lack of opportunities for education we have seen an increase in that due to the limitations that COVID presents. For us, a huge issue has been immigration. We, whenever possible, we try to work with our young mothers to help them with their immigration status, but the immigration processes have been extremely delayed, and that has presented huge issues for our young mothers. Lack of or limited childcare, and is also connected to COVID, because we provide childcare, but due to COVID, as you all know, there is a lot of limitations. So many times we also have encountered the situation that we may be able to find childcare, but not in their young mother's local community, which presents then other issues of transportation and linguistic challenges for our, not just the children, but for the mothers as well, that we need to either place them far from their local community, or if they are able to stay in their local community, then we need to figure out transportation. That has not been easy due to COVID as well. We, one important issue has been when our young mothers or their children are diagnosed with COVID. That affects them in many areas, including housing. Sometimes they are living with friends or relatives, and there is not the same opportunity of isolation. So we need to be very creative in finding ways to help them take care of themselves. We, DCF, luckily, we were able to identify a couple of programs that will be willing to take children who are diagnosed with COVID, and we have had quite a few of them. I remember one that actually broke my heart because it was a 4-year-old girl who was diagnosed, and we ended up having to bring her to what we call a COVID-19 program. The staff was absolutely amazing in helping this 4-year-old because she had to stay there for 2 weeks. And they all fell in love with the 4-year-old, but she had to be separated from siblings and the mother. And that, as we know, I mean, especially at that age, it's not easy. So our young mothers face poverty in any, during regular times, but COVID enhanced the poverty situation with food issues. We have noticed that when we work with our young mothers, sometimes even when we get the 51A reports, the reports of abuse or neglect, something that initially may look as neglect is just plain poverty. Is this mother is struggling to be able to get basic necessities for their children. So we have also found creative ways to try to support them around that. Something similar with education opportunities. We know that, when them having to attend school, the children virtually, something as simple as being able to provide an iPad or a computer solved a lot of issues for the mother when initially we had received the report from the school that the child was not attending class, and it was just because they didn't have the right device to be able to attend. So those are in general the challenges that we have seen. We saw decrease in reports at the beginning of the pandemic. We were a little concerned, but now we are seeing an increase again. We are not at the same level of number of reports that we had before the pandemic, but we are getting there. We're very close to being there. And we suspect that with children being allowed to go back to school in person, we're going to see a huge increase in reports as well. Thank you.
Thank you, Monica. And Lisette, I'd love to hear your perspective as well.
Sure. Good afternoon, everyone. Thank you for having me, and I'm so happy to see familiar faces. Before I go into the impact of COVID in our communities, I just want to give you a brief overview of the program that I oversee at the Department of Public Health in the Office of Sexual Health and Youth Development. So for us, the Pregnant and Parenting Teen Initiative is a case management model that builds authentic relationships between a caring adult and young parents. We provide services to expectant and parenting youth ages 14 to 24 and their families in order to increase opportunities, life opportunities, and enhance family stabilities, housing stabilities, and priority communities. A lot of the success of this program is rooted on strength-based 2-generational case management model that where the participant receives services tailored to their individual needs. And I'm so excited to say that Roca has been a partner of this program for the past 10 years. And to answer the question, I think for us, the model, because this model is different than other programs or other parenting programs, we were able to pivot and shift with the impact of COVID. And this case management model has allowed us to really serve the need of the population. In the department, we define, the social determinants of health as a condition in which people are born and grow, live, work, age, which contribute to the health inequities. And what we have seen is, we provide services in 5 different communities that we call, priority communities at the state, but we really understand that these 5 communities, one being Chelsea, Family Services, at Lawrence, Springfield, Holyoke, and also New Bedford as communities that have really high teen birth rates. And when we talk about high teen birth rates, we talk about exactly what India and everyone else has said. We talk about 8 times, the teen birth in Black and Latinx young women. We talk about housing stabilities. We talk about all of the things that have already been discussed. And then we add COVID on top of all of that. We want to make sure that we highlight, that a lot of these communities have seen a lot of the inequities that we are talking about previous to COVID. COVID, as everyone has said, has really just exacerbated those needs for these young families. What we have seen is all aspects of public health has been affected during COVID for this population. This population has been hit extremely hard in many different ways. We have young families that are frontline workers trying to attend also remote learning and also provide supports to their children, not 1, not 2, but sometimes more than 3. We have limited access to basic needs. We talk about school, we talk about transportation, we have housing stabilities depending on where they live or who they live with. A lot of the times, we talk about, if we focus in Chelsea in particular, Chelsea was a red zone for a very long time. And we talk about families living with one another and the impact of COVID, and also not having stable housing is a huge issue with this community and with this population. We also talk about an increase in DCF cases. I know that, right now, for some of our agencies and for DCF, you saw a decrease of that, but we have seen an increase in DCF cases. We also have seen an increase in domestic violence cases, and also loss of jobs, no access to food, difficulty in navigating different systems. We talk about a population that is predominantly a young parents, right? We talk about 14 to 24, and particularly in my program, and also getting different services at different times. The navigation of different services in the midst of COVID has been extremely difficult for a lot of our families. And we also have seen an increase in social and emotional concerns, and also mental health concerns. The list, I can go on. I think what we don't know is that what post-COVID is going to look like. What we don't know is what is going to happen with these families as we kind of get really clear about what's going to happen moving forward. And what we don't know is, we don't know. Folks have been stuck at home for a really long time trying to figure things out. We don't know what teen birth rates are going to look like moving forward. So these are things that we definitely need to take into consideration when working with a population like this. So thank you, India, for providing the space and the time.
Thank you, Lizette. And I actually wanted to follow up on that, because one of the things that we have seen, one of our long-term outcome measures at Roca is really hoping that we are working with young mothers to delay subsequent pregnancies, because we know that that gives them the time and space to really build their economic security and stability, and support their families in the way that they need to. And in just looking over our numbers from the last year, we actually had 56 new pregnancies, which is a significant number for us given the population that we serve. And so I wanted to know if, Lizette, you could speak a little bit to, what you see as some of the future public health implications for this population of young parents in particular, as we navigate the challenges and the kind of the leftovers of COVID over the next couple of years?
It's going to take a lot of systems thinking and systems work. I think for us is really making sure that young parents are in the forefront. This is the future of, we're talking about the future of our population, the future of Massachusetts, right? We have to also think about, you know, what are we doing right now, and what also are we going to be doing moving forward? We have to honestly really plan ahead, not have specific programs just to react. I think this is a time for us to come together and really understand what the need of the population is, understand what has worked in the past, and also what can we put in place in order for us to continue to move forward and provide the support that they need. I think from a state level perspective, we're excited to be partnering with the Department of Transitional Assistance to continue this work, and to really understand the different dynamics and the different systems that young families have to navigate within this work. And I'm excited to say that we are having different conversations about what does the work look like, what is it going to take moving forward for us to have young families be in the forefront, and also what are the resources that are going to take for us to ensure that they have everything that they need in order for not only for them to be successful, but also for their children to be successful. Because it is one thing to say that we're offering assistance to young parents, but we also have to think about the two-generational or also multi-generational approach that it takes in order for us to be able to support families in a long term.
And as I go through a couple of questions for our panelists, everyone, please do feel free to add questions in the chat, and we will get to them. We have plenty of time for questions. Kamaria, I'd like to go back to you for a second and just talk about how, you know, DTA has traditionally been known for administering really important benefits and services, ranging from childcare vouchers to food stamps to cash assistance to families. But you have really taken a holistic view as an agency to make sure that families are getting the supports that they need. And what are some of the ways that you've adapted, and what are some of the things that you look at and your staff is really working on these days in light of COVID and over the past year to make sure that young parents get more, you know, we know that they need more than just the cash assistance, that more than just the food stamps. And so what are some of the things that you as an agency have done to address some of the more holistic needs of young parents?
Sure. So I think as a department at the beginning of COVID, I think our goal was to make sure that folks could access these necessary benefits as easily as possible. So we were able to put our cash application online. We were able to waive our work program requirements. We wanted to kind of put all practices in place to make sure folks were easily able to access these benefits. And then particularly in our education and training programs, we wanted to kind of highlight the work that was being done by the providers. Like I said before, you know, the providers were so quick to be on the ground and making sure that folks were getting food and getting diapers and getting homework packets and things like that. And our young parent program is the goal of it is education based. So the idea is that you can increase your economic mobility through engaging in various education programs, either through your high set or through post-secondary education. And so those had long been the kind of main aspects of the program. And so once COVID hit and folks, you know, not only didn't have actual access to those options, but also it just wasn't necessarily a priority for them at that point. We wanted to make sure that we were able to acknowledge and compensate providers for the work that they were doing. And all of the work that we want to do in our employment and training programs, we want to be client-centered. And clients' goals were changing right now, and their families and their economic mobility goals were changing at this point. So we allowed our providers to be compensated for virtual outcomes, essentially, acknowledging any of the work that they were doing specifically to make sure that their families were engaged and not necessarily policing what that engagement looked like. So if that meant the providers were just calling folks on the phone every day, just checking in, making sure they had food, making sure their kids had the necessary homework, whatever it was that they were doing, they were contributing to the economic mobility and just the immediate safety of that family. So we wanted to make sure that was acknowledged. So that was one of the first things that we did. And then additionally, we were able to open up some of the other kind of pillars that we have in our program. So like I said, it's an education-based program, so we're looking for educational outcomes. And a lot of those educational outcomes you were not able to obtain. So folks were not able to get high sets for a while. Folks were not necessarily able to enroll in post-secondary education. But there were some things that they were able to do. Perhaps it was goals having to do with their children, or perhaps it was, some specific personal goals that they had. And we were able to allow providers to support our young parents and compensate them for that as well. So again, I think moving forward, as much as we can allow our providers to support the young parents, they're the experts in that. We're lucky enough to have Roca as one of our young parent program providers, and they're experts in the young parents that they work with. So I think our goal for the future is to just make sure we can stay as creative and stay out of folks' way as possible. And I think, like Lisette said, collaboration is going to be huge going forward, and a pooling of resources between state agencies. I work very closely with Lisette. We share these young parents among our community-based providers. So I think, just coming forward, learning what the biggest challenges are, and leveling them up to the state level, and seeing how we can work between our agencies to remove any kind of roadblocks is going to be crucial to supporting these young parents going forward.
Thank you, Kamaria. That's really awesome to hear all of the things that you've done. Monica, I'd love for you to speak for a second. I also come from the early childhood world. We have a lot of early childhood friends on this call. And, we are all, as a Commonwealth, really concerned about the state of early education and care, and the sustainability and availability of high quality and affordable care. But the populations that you and us at Roca work with, we are reliant on, childcare vouchers, supportive slots. And I know at Roca, are seeing a lot of challenges in families being able to access those supportive slots. We're also seeing that the group of providers that our families have access to through those childcare vouchers is limited. And in many cases, it doesn't help us help our moms go back to work because of the confines of the hours of childcare that are available, how often childcare closes due to the precautions that they have to take with COVID. What are some of the challenges that you see for the young children, and for getting that? You spoke a little bit about the challenges regarding, children attending school and childcare, and I'd love to hear a little bit more from your perspective about what supports young children need that we need to be addressing as a community, as a state.
So yes, so childcare was extremely affected by COVID. As you know, initially, the centers, many of the centers were just closed, and we all had to just stay home. So initially we felt that we needed to kind of put our heads together and figure out, okay, how can we be creative? Because in addition to our sort of regular concerns about, isolation and housing challenges, in which in many situations we knew that some of our families, the families involved with us, were in overcrowded situations, we also felt that that would absolutely directly affect the well-being of the children, and making sure that we immediately identified what we called at the time emergency childcare centers. And so we were able to identify centers that will take referrals from DCF, and we needed to then identify how to prioritize who were the children that needed immediate attention that could not stay at home for many different reasons. So in that effort, we partnered with early childcare and education, and they were able to help us identify the same childcare centers that were available for the first responders, for the medical providers, were made available for DCF families, of course, on an unlimited basis, because, you know, we needed to prioritize. So when that was the initial response, then we were able to continue to be creative. We were able to even partner with our foster parents. Some of our foster parents said, you know, we're home, so during the day, if you need help with other children, maybe during the day we can help with what we will call babysitting, which would be another way to provide childcare. So COVID really kind of forced us to be creative in how to find solutions for this type of situations. There were situations in which we had to play the young mother with the child or children in a program that may be far away from the local community, but at that point, that was the best solution we could find. Of course, that presents other challenges like cultural and linguistic barriers. A number of our young mothers speak other languages, and when you remove them from the local communities, that creates another layer of disconnection for them, because they go to communities where it's not as easy. One of my supervisors was saying to me, I mean, we take it for granted, but the fact that you're not able to go to the bodega at the corner to get the food that you are used to eat is another stressor for those families. But in terms of education, we were able to also, even for young children, provide devices for them, because we felt that was a huge need. It was identified early enough, and so there was an initiative in DCF. We work with all our supervisors and social workers to have the conversations with the families as of, okay, identify what kind of devices do they need. And I mean, also for children who were placed in foster homes, we making sure that the foster parents also were enough technologically savvy to be able to help the children, because believe it or not, there were some of those challenges that, you know, the grandmother or the great grand aunt would say, I don't know how to work with the computer. You need to help me figure out how to help this child. So our workers were doing in-person visits to try to help them figure out how to work with those devices. Of course, we had to provide all the PPE and equipment to protect not just our workforce, but we also provided that for our families and children.
That's wonderful to hear. We did the same, and I agree, you know, in this environment, you don't worry about screen time, but you just need children to have access to learning opportunities and things that keep them engaged. And also that gives some parents a little bit of respite as well. Yeah. Monica, you know, another question I have for you, and I'm sure this is on many people's minds, and we have a lot of providers on this call as well, is, you know, I can only imagine, you know, from the conversations you and I have had, how traumatizing the past year has been for your staff in terms of staff burnout, and just, you know, the incredibly difficult and complicated situations and the limited number of solutions that you faced. And I know that for us, we feel really privileged to work with you and your staff in Chelsea, because we've been able to just come together in a different way to collaborate and take some burdens off of one another, or work together innovatively to think of some solutions and ways that we might be able to support a family where we have a little more wiggle room than you do, but and vice versa. But I wanted to know, what are some of the ways that you've addressed some of the staff burnout and the mental health needs of your staff?
So I have to say, first of all, I have to acknowledge that you and Molly have been great in always reaching out to us, because you know and you have a close relationship with us, and you have offered to support us in so many different ways. Sometimes I have not been able to respond at the same pace because we are kind of putting fires out with the emergencies that we deal with, but we really appreciate the partnership. Challenges, my staff has been, absolutely awesome in the sense that, just imagine having to, we have had conversations with them in which we say, with the families that we work with, yes, there is only so much that we can do virtual, but there comes the point that then you have to do the in-person visit because you need to verify that the children are safe. Mm-hmm. And of course, the initial reaction is, oh, but this is a pandemic. How are we going to be safe? So there was a huge response from our agency in terms of making sure we provided every piece of PPE available, from masks to face shields to gloves and gowns and sanitizers, all of those pieces. But it's still a scary proposal to have to say, with the issues that we deal with, is child protective. We need to make sure that you see the home, that you enter the home, that you are able to make sure that those children are safe in that home. Initially, when the weather allowed that, we advised them, you don't have to have the entire meeting inside the house. You can use maybe the backyard, maybe you can go to a park, be creative. But I was always thinking, but if I was a worker, that had to still be scary. And many of our workers were also transporting children. And many of our workers were transporting children knowing that they had been exposed to COVID. So in those situations, we said, double up the PPE. I used 2 masks instead of 1 because this child was exposed and may be diagnosed, and they had to take them to the hospital. So all of that ends up taking a toll. One big issue for us has been, especially for brand new social workers in my office, because somebody else mentioned earlier, we were in the red zone forever and ever until just recently we were able to move to the yellow zone. But during that whole time, it was just making sure that we still were able to see the children. So we will hire new workers who had no opportunity to be in the office as part of their training, had no opportunity, not as many opportunities, because we try to create opportunities, but it's not as easy for shadowing workers doing an in-person home visit. We provided opportunities for virtual shadowing, but it's never the same. I do meet and greet meetings with every new social worker. After a couple of months, I could see that they were burning out, and they had just gotten there. And so we are in the process. Supervisors and managers are working together to try to figure out how to stop that. Yes. Because it has been extremely challenging for us. It's a huge investment for us to recruit and hire new workers, train them, and then they get scared. They feel I haven't received the proper training because we don't have the opportunity due to COVID. And then they say, I'm not sure I can do this job. So we are working very hard trying to prevent that. But, and Chelsea has always had the wellness groups in which supervisors and workers lead groups to try to provide support for workers who are dealing with difficult situations, challenging removal, or a home visit that was difficult, DV situations, all those type of traumatizing events. Then there is wellness groups every other week. Right now they are done virtually, but we never stop that. I wanted to mention that I forgot to mention before, additional supports for our families and also specifically for fathers. I know the focus today is on young mothers, but we never stop with our family nurturing programs. We were able to do it virtual, and the numbers actually have been great because families have responded very well to the virtual programs, and the father's nurturing program also has been very successful.
That's really wonderful to hear.
Thank you.
Thank you. So a couple of questions have come in through the chat. So Kamaria, I'm going to give this one to you. We have a question about, how you think about employment opportunities for the population, for this population as we emerge from COVID in the coming months and year. And I know that's a tough question and you may not have the answer to that. And I'm sure everybody is eagerly awaiting the answer to that, but
I mean, I don't have the crystal ball to solve all the problems, but I do have some ideas. I think what we've been thinking about from our end is partnering with employers whenever we can, and having that partnership include some kind of training. Before COVID, we have one of our employment and training programs is our DTA Works internship, where our TFDC clients are able to participate in an internship where they are paid a stipend on top of their benefits. And we had a planned partnership with Mass General Brigham and with Project Hope in Boston, where Project Hope would provide the training for a particular role that MGB needed and was having trouble filling. So Project Hope would provide the training, and then they would be placed in an internship at MGB with the hope that eventually they would lead to employment. And I think our start date was like March 15th, the day that we were sent home. So we had a couple of options. We could have abandoned it, or we could, like all of our other programs, figure out how we could translate that into our new environment. So the staff in that program were able to change it to a remote program, essentially. It took a while, but Project Hope and MGB were able to procure devices for everybody. They were able to do the internship remotely, and that has led into remote job opportunities at MGB for a couple of those folks, and we're just about to start a new cohort of that. So I think we have to think that way. I think as much as we can provide training for necessary jobs, for jobs that are, high in the labor market and jobs that folks need, I think we have to think about it that way. I think employers also, we would love if they were creative and, considered partnering with us and considered using our population as much as possible. I think, there still is a lot of fear out there. I think there's fear in going back to school and childcare and getting to work and transportation, all that stuff. So it's gonna take a while, but I think that's the avenue that we're leaning towards, is just partnering with employers, partnering with community-based agencies that already have those partnerships as well, and seeing how we can best support our young parents that way.
Thank you. Another question for any of you, I don't know, Lizette or whoever would like to take this, but it's become increasingly clear that the pandemic has had profound impacts on the mental health of everybody, but particularly among vulnerable populations. And what are some of the strategies that are being used or could be used to address the mental health of this population in particular?
I can start. One of the things, so, you know, I gave a little bit of a background of the Pregnant and Parenting Teen Initiatives program. To be quite honest, MPPTI was funded for about 10 years and actually ended right in the middle of the pandemic, June 30th, 2020. What happened was that we were trying to figure out exactly how to move forward. And also, thankfully for agencies like Roca and other agencies across the state, they were able to continue to provide supports. One of the pieces of MPPTI is that we require a pretty multidisciplinary staffing model. With that, I think right now, I'm happy to be here because of the collaboration with the Department of Transitional Assistance. We received some funding through an ISA and are able to provide the same services, a COVID response service to the MPPTI communities right now. And we're still continuing to provide those services. Within the COVID-19 response funding, we knew and we talked to our providers right before MPPTI ended back in 2020, right in the midst of everything, with the understanding of, you know, what are the different shifts and changes that this population now requires. What we were able to do is within this funding to embed into that particular language, what, you know, to ensure that they have one, a pretty robust MOU with a mental health agency or with a staff that is embedded within the program that is able to provide mental health screening and also mental health referrals. So that is a huge part of what is happening right now with MPPTI, and hopefully we can continue that work moving forward as well.
For sure. Thank you. And then we have a question about just two last questions. One is what we're hearing from young families with elementary age children about the efforts to return K-5 children to full in-person learning. Is this a positive change, and are there concerns for safety? You know, I think Monica, you touched upon this a little bit. I can answer from Roca's perspective in that I will say that there has been a lot of hesitancy among the population we work with about children returning to school and childcare, and I think that will persist. And we work with a population of parents who are, you know, when the majority of us get an email from a school or a childcare center detailing all of the extensive things that they're doing to keep our children safe, we feel really reassured by that. But we're working with a group of parents who, when they see an email like that, they wonder, well, what's going to happen if my child doesn't stay within that 6-foot circle or hula hoop? Or, you know, what if my child really needs a hug? What's going to happen? And so from our perspective at Roca, I know that we are definitely seeing and hearing a lot of anxiety about return to in-person learning. And that's also been, there's been a lot of hesitancy around the return to childcare as well. And so, so that's something that we're really trying to work with in terms of helping young parents understand and feel safe about the steps that are being taken, and really explain, you know, what is a fact and what is not a fact, and, you know, how we have to put the best interests of the children at the center. But I welcome any of you to add to that. All right.
What I can add to that is we have seen some of a similar response, and it's just, we need to acknowledge that the fear is real, that our young parents don't know what's really going to happen, and whether or not especially with younger children, how they're going to, in their little heads, how they will be able to understand. You know, I myself have a 5-year-old granddaughter who refers to the virus as that little monster that she has to run away and not be close to it. But one big issue is for those children with other diagnosis with some children with special needs who then we need to figure out how to accommodate those special needs at the same time that we try to reintegrate them, because we know that it's important for them to socialize and to be able to be with other children. That for us has been a challenge. Even now that we are doing family time in the office to allow the parents to visit with the children when the children are in care. Especially those children with special needs present a challenge, because it's much more difficult for them to understand the importance of distancing, the importance of always wearing the mask. And that has been a worry, I know, from my workers at the time that children need to go back to school.
I agree, thank you. And then just to end on maybe a slightly more positive note, one final question is, what are the signs of hope that we see in this population? What are some of the positive changes we hope to see if we put these supports in place that we've been working on? And so I'd love to hear everybody's perspective around this. You know, I can say from Roca's perspective that you'll hear this later when I send out Brianna's story later this afternoon, but this has really given us the opportunity at Roca to use technology in a different way and to really adapt the way that we provide our services so that we can continue to provide them at the same level of intensity, but just in a different way. We, like Monica's staff, have been going out throughout the pandemic, giving rides, you know, going into people's houses. We need to lay eyes on people, but at the same time, it's also allowed us to be a little creative in terms of creating Facebook groups for our moms and things like that, where they're building those social connections, which, you know, we used to do every Wednesday at family night at Roca. And so, you know, we are seeing some signs of hope in seeing our mothers come together and really understand that there are others going through the same things that they are, and really utilizing supports that we're now able to provide virtually to stay resilient and hopeful. So I would say from my perspective, that's been one of the greatest things. And the other thing is that, you know, the relationships that we have with the providers in the community and at the state level have really deepened and intensified in a good way. And I'm really, really grateful for that. So I'll turn it over to Lizette. Would you like to go next?
Yeah, from a young parent's perspective, I think that what we've learned for the past 10 years is that young parents they're amazing. They're amazing young people that come with an array of different resources and ways in which we can't even imagine. I mean, I think once you all hear the young person that Roca is about to send you, their story, you also understand that they are very resilient and also are the experts in their own lives. Sometimes we tend to, you know, try to figure things out for them and try to, you know, place programs in ways that that don't necessarily, you know, have people's best interests. I think one thing that I'm hopeful and excited about is that to continue to do this work and to continue to support young, you know, programs across the state in collaboration with the Department of Transitional Assistance. I also am hopeful for the collaboration piece for agencies across the state leading this work, and to continue to have conversations that are meaningful and that ultimately will continue to support this population in a meaningful way. So I'm excited about that. I'm excited about this work and excited to be here.
Thank you. Kamaria?
I would just echo what both you and Lisette said. I think, you know, I'm hopeful for the continued collaboration. I think a lot of this work has really deepened during COVID. And so I'm happy that happened and excited to see it move forward. I think it's absolutely necessary. And I think, you know, I'm hopeful because our young parents are still there. You know, they don't necessarily, at least for our programming, they don't necessarily have to be. You know, they got a whole lot of other stuff going on, and they don't necessarily need to continue to engage, but they still do. They're still, you know, despite everything they're going through, they're still actively, you know, engaging with their community-based providers. They're still looking to connect with other young parents in their area. And so I'm very hopeful that that continues. And I think one of the things that we've committed to doing at DTA is incorporating the client voice more into our policies and into our practices. And I'm very hopeful and very excited to hear from our young parents and to hear what they've learned through this, and to tell us what we can do differently and what we can do better after that.
Thank you. And Monica.
So I know that it has been challenging, but I also have been able to see some kind of unexpected positive side effects, for lack of a better word. One, even though as I mentioned before, we noticed a decrease in reports at the beginning of the pandemic. The other day I was having a meeting with my intake and response units, which are the ones who screen the reports and who investigate the reports. The feedback that they were providing to me is that they feel, for whatever reason, that in general, the parents feel more open when the interview is virtual. And they couldn't explain the reason for that. They are more open about their needs. They are not as guarded or defensive, because they were telling me, a couple of investigators were sharing with me that, you know, when we show up as investigators at their home, you immediately see kind of the reaction. We have noticed that when we are doing these interviews virtual, of course, some of them, they have to go to in person. Some of the visits are in person, but many of the other visits are virtual, and they feel that they have been able to get into a much deeper conversation in which the parents are more open to explain their needs. As simple as, you know, maybe I need a better cell phone. Can you help me with that? Maybe I need a referral for mental health services. That they felt the conversation was not as easy before. And we cannot even explain the reason for that, but maybe having the conversation through the screen is less intimidating for them. We have seen that. And so that's giving us more hope that the fact that we get less reports may not necessarily be something that we have to worry so much about, but that with the appropriate supports, maybe the numbers are real. Maybe we can hope that we will have less incidents of abuse or neglect. So that's the hope that I want to give today.
Absolutely, I love it. So with that, I wanted to thank everybody for joining us, and I just wanted to turn it back over to Angie Jansen to close out our program today.
Thank you, Sunindya, and wow, what an amazing discussion. Thank you to all the panelists for sharing your insights and your expertise and showcasing how much thoughtful work goes into supporting this group of women and all of the work that you do. I just wanted to close with a few words about the Young Mothers Advisory Board at Roca. Our goal is to be a searchlight, essentially, in search of tools and resources that could be mobilized to support Roca's work with these young mothers. So we bring our skill sets, our networks, and our leverage points in the greater community to contribute to their ongoing success. This conversation is just the first of several dialogues that we hope to have in the coming months. The next few will focus on actionable strategies that will help these young mothers in specific ways, in breaking down emotional and psychological barriers to accessing supports, and helping them be the best mothers that they can be, and in identifying opportunities to plug them into the local economy. So if, as you were listening to this discussion, you had a light bulb moment, like I have a resource that might be a match for these moms, or I have an introduction I could make, or there's a resource that I should share, we would love to invite you to join in these sessions and share your insights. Or if you're simply interested in continuing to learn about this group and the evolving work, we would love for you to join too. But our goal on the Young Mothers Advisory Board is to mine our broad community of supporters for your insights and your resources that we can use to continue to build upon this work. So if you're interested in learning more, we would invite you to reach out to us with any questions, either Sunindya or myself. We will also be following up by email. But we hope that you can continue to take some of the learnings from today and see if there are areas where you might be able to be one of the supports that we can continue to draw on. So thank you so much, everyone, for joining.
Thank you, everyone. Have a wonderful day and happy International Women's Day.
Thank you, everyone.